There is a woman somewhere right now who has been called too lazy for her entire life. She has been called oversensitive, too emotional, can't finish things. She's now in her 30s and 40s, and finally she got a relief. She's diagnosed with ADHD. Interestingly, she's not frustrated. She is really relieved because finally there is a medical biological explanation for what she has been blamed for her entire life. Indeed, in women, it takes from 4 to 12 years to diagnose ADHD, attention deficit hyperactivity disorder. And when finally they are diagnosed, they end up to have more severe symptoms compared to men. Those are like depression, anxiety, difficulty to navigate their day-to-day life. Today, I want to explain you why. Because the answer is just not the doctors. There is something deeper there. So let's explore together. So what is ADHD? ADHD is a neurodevelopmental disorder which is present from birth, and then it determines how your brain will wire and develop further. Turns out in ADHD, there are two pathways which are impaired. So first one, this is dopamine pathway, and the second is norepinephrine pathway. And they are impaired particularly in two brain regions, prefrontal cortex, and the second one is basal ganglia. So prefrontal cortex is this area of the brain which is responsible for your focus, planning, impulse control, and ganglia is responsible for reward processing, motivation, and habit formation. And in ADHD, indeed, dopamine signaling, particularly in these regions, is not efficient. Dopamine is this molecule which helps you to be motivated and focused. So it helps you to start the project and stays on the project, on the task. While norepinephrine is the chemical responsible for the alertness and attentiveness. And now imagine your prefrontal cortex as a CEO of your brain. So it decides and plans which projects to start, and also sometimes it does also impulse control in the team. In the ADHD scenario, your CEO is understaffed. And there is also this reward center, basal ganglia, which decides, okay, this task will not bring a direct reward, direct result, so let's not do it. So it just chooses to do the tasks which are really rewarding immediately or in a short term. So tasks without immediate reward feel almost impossible to start. Dopamine in this case is not too little. The key here is that the dopamine molecules or signaling are not happening on the right time, on the right place, and the signaling strength is also different in case of the ADHD. Finally, what are the reasons of this ADHD diagnosis gap between men and women? The first one is the training. So doctors are trained historically to recognize the pattern of ADHD, the picture as an unattentive boy in a classroom who is very hyperactive, running, cannot stay still. On the other hand, there is also clinical research in ADHD, which is mostly performed on men subjects. Women, meanwhile, have more inattentive type of ADHD. They used to daydream more, lose their focus, cannot concentrate on the task longer periods of time. The second massive reason is the masking. So women or girls from the beginning on put a lot of effort, cognitive behavioral efforts to mimic the behavior of their neurotypical peers as more organized, focused, put together, but indeed this internal hyperactivity and chaos in the end turns to the anxiety and depression episodes. So to understand masking better, imagine a woman who runs a marathon every day just to appear walking normally. This depletes, of course, already the executive functions, which otherwise are already depleted in ADHD. And it's not hard to imagine that women have more comorbidities, co-occurring disorders with ADHD, which is a depression and anxiety. This is not normal. It's a survival mechanism which women demonstrate. Men generally used to show more their symptoms. They show the hyperactivity, they show this disruptive behavior, they externalize, while women tend to internalize more, which means they are ruminating more, self-criticizing even harder than before. So I want to explain you how estrogen directly affects the dopamine system. So estrogen initiates the dopamine and serotonin production. On the other hand, it also initiates positively the receptor production of the dopamine. Estrogen also inhibits the monoamine oxidase enzyme. If it is active present, it degrades the dopamine molecule. So imagine now the estrogen plays a role of this volume dial. When it presents, the signal, the sound volume becomes more. When it is not there, it's become less. Now imagine that in neurotypical women who doesn't have ADHD, these fluctuations of the hormone and the signal differences of the dopamine system can be manageable. But in case of the ADHD women, indeed, the estrogen fluctuation and these dopamine signaling differences can feel like a roller coaster inside, even more chaotic during the entire cycle process. Understanding the estrogen dopamine mechanism helps us to see the predictable pattern which exists during women's life. So first is the puberty, when estrogen starts to rise slowly. Indeed, some symptoms of ADHD can become milder, which is better focus, they feel more put together during the puberty, and generally it feels more emotional stable period. Later on, as discussed already, when menstruation starts, because of estrogen fluctuations, the emotional state can differ drastically during the entire time. 1 week before the luteal period, it feels the worst emotional stability deteriorates, focus collapses. Pregnancy can feel relieving, and many ADHD women feel they are sharper, they are more emotionally stable, because indeed estrogen surges during this entire pregnancy time. Later on, when it comes menopause and perimenopause, around 40s, finally, women who were coping with their ADHD symptoms during their entire life fell. And this is because estrogen starts a long decline process. That's why women with ADHD are frequently misdiagnosed with dementia, anxiety, depression exactly during this perimenopause and menopause period in their life. Here is the last piece of the ADHD puzzle that I want to discuss with you. Turns out that ADHD medication can have a different effect on women compared to men. The most commonly prescribed drug for ADHD in women, methylphenidate, indeed increases dopamine much stronger in women compared to men. And indeed, because estrogen also affects directly dopamine receptor production, some medication can have a different effect during a different menstrual cycle phases. So in a follicular phase, the same drug dose can be more efficient compared to the luteal phase when there is less estrogen. But most of the prescribing guidelines are not considering this. And indeed, many psychiatrists are not really asking a woman in which menstrual phase are you currently to adjust the dose accordingly. Now I want to be completely honest with you and say where science stands. Estrogen dopamine connection is quite well supported by mechanistical evidence. However, there is no large randomized clinical trials which will see what is the effect of hormonal therapy, especially in menopause and perimenopause women, in terms of the ADHD symptoms improvement. So there is a lack of clinical trials to really help us to go forward. Final issue is that most psychiatrists were trained before women female specific data become available in ADHD area. And the other thing is that gynecologists are not well aware about ADHD and the hormonal link. So the burden again stays on the patient's shoulders to really collect this all information and link them in between. So that's why I want really to be honest with you and give entire evidence-based data knowledge which exists currently. Here is one practical action for this week or for a month. You will see what I mean now. So for one full cycle, track 2 things once a day. First, your ADHD symptoms. You can use a scale from 1 to 5 to rate your focus, emotional regulation, task initiation, whichever hits you hardest. And the second, the day of your cycle. For example, day 1 is the first day of your period. At the end of the month, map the numbers against the cycle days. If your worst symptom day is clustered in the luteal phase, it definitely makes sense. Remember what I was telling you before about estrogen dopamine system connection, and now you have the evidence. So take this data to your doctor or psychiatrist and just use it not as a complaint, but as evidence to just find the best treatment way for you. My dears, as a molecular biologist and a mother of 2, I want to tell you, if you have an ADHD or you suspect you might have an ADHD, if you have been called for years as emotional, too sensitive, too intense, not focused, messy, just remember one thing: science is only catching up to your experiences now. You were not broken. Consider this: you were not studied enough, and that makes a difference.